When we graduated, we were told go to the city because that's where the jobs are, that's where the opportunity is. So went there, and what I actually found was the complete opposite, that I was actually more isolated, more pigeonholed, there was less opportunity because I was competing against more people.
The benefit of going rural is that you get to learn something new every day and try something new every day. You're only limited by the workload that you want to take on.
We went rural because we wanted to experience small town Australia, not city life. And we wanted to have adventures in the outdoors on the weekends. And we wanted the rural community setting and the climate.
As an employer, the RDN has been an absolutely fabulous resource for attracting talented and committed clinicians to our area. We've actually doubled our staffing levels since the RDN started. I think we've got about 7 or 8 members of our staff now that came through that program, and it actually gives us a competitive advantage when it comes to recruiting people who might otherwise not choose to come out to rural areas because of the financial risk associated with picking up your life and moving. So it's great to know I have someone assisting me with that stuff so that I can focus on making sure that people's work experience is fantastic as well.
Well, RDN helped us by providing a really comprehensive package which paid for us getting here and paid for us to set up a household. So there was no cost involved for us, which was very attractive.
And we got training and attended conferences, which meant we were up to speed with what was happening in mental health in New South Wales and the challenges that they were facing.
The local Mudgee community has been really welcoming. They're stoked that they don't have to drive a 500-kilometre round trip to either Sydney or Singleton to receive exercise physiology services.
Personal satisfaction and career advancement are probably the biggest rewards for me. You have so many more opportunities to spread your wings in rural areas, and people are much more willing to give you a chance to excel. I also like the fact that I can walk down the street and see evidence of the good that we do every single day.
We were really surprised at how welcoming people were, and our colleagues really wanted us. They valued us being there immediately when we arrived, and we've never had such a busy social life.
I urge all allied health professionals to consider going rural. I think a lot of metropolitan clinicians will discount rural practice based on urban myths such as there being no shops, no lifestyle, career death or isolation. But I actually believe that the opportunities and the ability to advance your career a lot faster and a lot more broadly in the bush is much greater than what you would necessarily receive if you chose to stay in a metropolitan area.